Dr. Susan Love, and I'm Chief Visionary Officer of the Dr. Susan Love Research Foundation. Our mission is a future without breast cancer, and we do that through innovative research into the cause and prevention of the disease. Inpatient Science is a series of videos that we've made to help you understand your diagnosis and treatment choices that you have.
If you are thinking about participating in a clinical trial to treat your breast cancer, figuring out your options can be confusing and complicated. Your doctor may not know all the possible studies you could be eligible for, or they might not mention clinical trials at all. As a result, doing some research on your own will help. The websites breastcancertrials.org and clinicaltrials.gov are good places to start, and many cancer centers, including the National Cancer Institute, list their clinical trials on their website.
Finding a study that interests you is the first step to taking part in a research study. Then you need to contact the study coordinator, who will ask you some questions and determine if you're eligible.
If you can take part in a study, you should ask what expenses the trial will pay for, like travel costs or follow-up care, and find out what your insurance company will cover as well.
It's also important to talk to your doctors to see if they have any concerns about your taking part in a trial.
Most health insurance plans cover the routine parts of care provided to patients in studies that have been funded or approved by the federal government. If you have tests that would normally be part of your cancer care, they are considered routine and should be covered by your insurance. If a test or scan is being done only for the researchers to get information, it is not considered routine and will typically be covered by the clinical research study.
Of course there are exceptions. You should never assume what a research study will cover or what your insurance company will pay for. Don't be afraid to ask questions.
If the trial's doctor or hospitals are out of network, not part of your medical plan, you may need to ask even more questions to find out exactly what is covered. Before you officially enroll in a clinical trial, the study coordinator will lead you through an informed consent procedure, making sure you fully understand the trial and what you can expect, including any risks you may face by taking part. You have the right to know why the trial is being done and what the researchers hope to accomplish. You also have the right to ask as many questions as you need to feel comfortable about participating.
Keep asking questions until you understand all the possible risks and benefits. Only then can you give true informed consent.
Participating in a clinical trial might seem intimidating at first, but it can provide some additional options for your treatment. Taking part will also give you the satisfaction of knowing you are helping researchers learn the best treatment options for the next generation of women.
Our mission at the Dr. Susan Love Research Foundation is a future without breast cancer, and we do this through innovative research into the cause and prevention of the disease. You can join us at drsusanloveresearch.org to participate in our research or to help fund our research, because together, and it's going to take all of us, we can be the generation that ends breast cancer.